Hello and welcome. I'm Dr. Keith Lynch. I've been in private practice here in Central Virginia in Charlottesville since 1998. And I've been board certified in Atlas Orthogonal Chiropractic since 2000. What we're going to talk about is our structural adjusting program for the Atlas area. Now the Atlas, or C1 as it's known, sits right underneath the skull. It's the very top vertebra of the spine. And that Atlas vertebra weighs about 1 to 2 ounces, and your head or skull above that bone weighs 10 to 12 ounces. In health, that bone sits right around and protects your brain stem, and it also has the vertebral artery, which brings blood supply up from the heart up into the skull through to the brain stem as well as to the cortex. So it's a very important area. When we make our adjustments to that area, we use a specific instrument that makes an adjustment force of about 1.8 pounds. So it's very delicate. And the reason is because when that head gets off-centered over the neck, it can put pressure on that atlas and blood vessel area. We call that neurovascular compression. Neurovascular compression means this. It means that the blood vessels can be compromised, reducing the amount of blood flow to the brain stem, which controls digestion, absorption, elimination. It controls our eye function and all the sensory organs inside the head, as well as cognition up into the cortex. So people who have migraine headaches, people who have epilepsy disorders, people with head, neck, and shoulder problems, jaw and facial pain, this area is often implicated as one of the sources causing those problems. So when we have neurovascular compression, it's going to put pressure on the blood vessels going through that area. It can also put direct pressure on the brain stem itself. And then it can also cause the muscles underneath the skull here to be extremely tight, reducing your range of motion and causing further problems both up and down the spine from that area.